At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. Nursing is an immensely rewarding and vital profession that helps people in need and saves lives daily. Nursing professionals diagnose, treat and care for individuals of all ages suffering from various physical and mental illnesses or injuries. Nurses also administer medications, consult with other healthcare providers to develop treatment plans, assist with rehabilitation and recovery, counsel patients and educate them about their health. A comprehensive care plan for nursing is essential to providing quality patient care. It outlines objectives and strategies used in the nursing process to ensure the patient's medical needs are met. It meticulously documents patient assessments, nursing diagnosis, interventions and evaluations. Nursing care plans also facilitate continuity of care, reduce errors, enhance patient safety, and aid in efficient communication among healthcare professionals. These further outline specific care and services including medications, treatments, procedures, lifestyle modifications, self-care strategies, and dependent and independent nursing interventions. Nursing care plans can be used in many different situations. Some examples of nursing care plans that we have at Carepatron, which you can use at your practice, are Risk for Infection Nursing Care Plan, Impaired Physical Mobility Nursing Care Plan, Chest Pain Nursing Care Plan, Small Bowel Obstruction Nursing Care Plan, Chest Pain Nursing Care Plan, Urinary Retention Nursing Care Plan. In most nursing care plans, there are the sections Assessment, Interventions, Rationale, and Evaluations. We will walk through how to use our general nursing care plan, which can be applied to our other nursing care plans. Firstly, download the nursing care plan. Get a copy of the free worksheet using the link in the description, or explore our templates library in our Carepatron website or platform. Fill in the patient information. Start by filling out the patient record section with the patient's name, age, date of birth, and other information. Also document the patient's medical history, current medication, and allergies. Enter the patient assessment. Assess patient's needs by documenting their physical, mental, and emotional health, considering the patient's health status using your nursing knowledge. Include any symptoms they may have and any diagnosis the patients have received. Develop the nursing care plan. Once you have assessed the patient, develop a comprehensive nursing care plan to address their needs. The plan should include short-term and long-term goals, medications, treatments, and other interventions. It is also essential to exercise clinical judgment in the process. Implement. Implement your nursing care plan for the patient. Implementing it may include an independent nursing intervention, like patient education on medication adherence, or dependent nursing interventions such as prescribing medication requiring a physician's order. Monitor and review. Monitor the patient's progress in achieving their goals over time. Revisit their care plan regularly to ensure it is current and meets their needs. Adjust as needed based on changes in the patient's health or other circumstances. Here is a sample of our general nursing care plan that incorporates the same topics previously mentioned, which you can incorporate into your practice. To discover more of our free templates, explore our templates library, which you can find on our Carepatron platform, linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free, just click on the link in the description. If you enjoyed this video, don't forget to press the like and subscribe button for more content like this.